our next session.
Thank you, Becky. So our next session will be from representatives from the Area Health Education Centers, known as AHEC. And we have the Executive Director, Dr. Jennifer Taylor, and the Associate Director, Greg Hetrick. I had the pleasure of joining their advisory board last fall, and as I shared with them many times, they're the best kept secret here. So excited to have you all learn how they can support your hospital. So Jennifer and Greg, I'll turn it over to you.
Okay, well, thanks for having us today. I'll go ahead and share my screen here. Being a little slow. Can you all see that okay?
Absolutely.
Okay. So I'm Greg Hetrick. I'm Associate Director for Indiana Area Health Education Centers, which is AHEC for short. You're going to hear us refer to ourselves in that acronym throughout the presentation. And we're going to present creating pathways and partnerships to develop a strong, diverse future health workforce. Then I'll let Dr. Taylor introduce herself as well.
Yeah, so I'm Jen Taylor. I have been here at the Indiana AHEC program at the IU School of Medicine for probably about 11, 12 years now. So I'm really excited just to share more about the program and how we can collaborate together.
So to start, this slide really just provides a summary of who we are as an AHEC. We're affiliated with Indiana University School of Medicine and specifically to the Department of Family Medicine. AHEC is funded federally through HRSA, or Health Resources and Services Administration, for those of you who don't know HRSA. And we receive state funding through the Department of Health as well. We receive some funding through the institution as well. And all of or most of those funds, I should say, go right back to our regional centers. The hosts of those regional centers are listed below. I'm going to explain that structure here a little bit more in a minute. But each of our regional centers has a host site that is an AHEC partner. And you can see those sites at the bottom of the screen. Those partners range from institutions of higher education, economic development organizations, non-for-profit organizations. And again, I'll talk a little bit more about them in just a few minutes. I mentioned that we're federally funded through HRSA. And so AHEC is a national network. You can see on the map the impact across the country where you see AHECs, both regional centers and program offices. And the National AHEC organization represents a network of more than 250 area health education centers, and then 50 university-based program offices. Program office is what Dr. Taylor and I are part of. And those different entities serve over 85% of US counties, particularly focusing on those rural and medically underserved areas. And then our own state is split into 9 regions, and the host sites are on the left. You've seen those already. And then the map on the right shows the split within our state and each of the counties that are represented in each of our 9 regions. Oops, I'm sorry, went too far there. Each of the regions has its own team that does the boots on the ground work to really build relationships in their communities, develop and carry out programming that aligns with our AHEC mission. And the program office that Dr. Taylor and I are a part of support each of those 9 regions efforts. The 9th center was added last year, actually, East Central Indiana, or ECI. Previously, the Northeast Indiana corner was NEI and ECI combined, so we split those into 2 and before they were combined into 1 region. So really, as you're looking at this, you can find your county on the map, and we're going to share some contact information later, but reaching out to your local center with questions or interest in getting involved. Our website has contact information for each of those centers. We're going to share that at the end of the presentation as well. And we'll have our own individual contact information too. And you can always start with Dr. Taylor or I, and we can point you in the right direction. So these are the challenges that we face as a state related to healthcare. I think many of these should seem all too familiar to most of you. We know there aren't enough primary care professionals to serve Hoosiers. This shortage leads to too many underserved communities across the state, and our vulnerable populations have limited access to quality health care. All but 14 counties are at least in part considered primary care health professional shortage areas, or HPSAs for short. More than half are dental care HPSAs, and nearly the whole state is considered a mental health HPSA. So we have all these challenges as a state with lack of or shortage area and lack of professionals in many counties. And we know that patients in rural areas often have to drive an hour or more at times to see quality health care. We also know that there are divisions between the missions of healthcare or health profession training programs and what the true needs are in the community. And finally, we know there's too little diversity in our healthcare workforce. This can lead to communication breakdowns, lack of trust at times with the patient-provider process. Patients may have distrust in providers, not believing they understand their unique challenges and cultural differences. So again, many of you may have experienced some of these challenges over the years. So AHECs exist to work towards solutions to the challenges that I just mentioned. So our AHEC mission, why do we exist? To enhance patient access to quality primary and preventative care for medically underserved populations, especially in rural and urban settings. And what do we do and how do we do it? Through our community academic educational partnerships, we're looking to improve the distribution, diversity, and quality of healthcare professionals in the state. And so we work, or I'm sorry, those community academic educational partnerships really allow our regional centers to learn the unique challenges facing their county specifically from those living and working there. And those different entities can work together using resources from academic settings, healthcare facilities, a variety of other groups to take on those challenges. So we work across a continuum, really starting with middle and high schoolers that are just exploring health careers and thinking about possible career paths down the road, all the way to those who are already working as health professionals here in the state. And so this continues on our website as well, but it gives you an idea of all the different pieces of what we do as an AHEC and the different points of contact along the way with those in our state that we serve. So initially, it's cultivating interest in health careers for students at different levels. Once they're interested, once they show that interest, it's getting them into clinical and community settings to train and get ready to enter the workforce. And then once they're ready to go into the workforce, we really help to recruit them into jobs in underserved areas across the state, those high need areas that I talked about earlier. Once they're there, we look to retain them so we can have that high quality healthcare workforce. Really, in the end, it's all about our health workforce development, especially in those underserved areas. And I mentioned those 9 regional centers. And I alluded to this a little bit ago, but each has their own locally employed director and staff at their host site. So they're able to address goals that are really guided by community engagement. Each of the centers has their own advisory board that really helps inform the needs in their community and figure out where that alignment can occur to meet those needs. So I'll go through the 4 goals here briefly. That really everything that we do as an AHEC kind of wraps into those 4 goals, and I'll explain those here. So for the first one is pathway programs. And for middle and high school students, our regional centers across the state offer a variety of programs that expose students to healthcare careers. That can include things like shadowing opportunities, multiple summer camps that focus on different career paths, special events, simulation days, and many more. Our centers also are in the schools giving interactive presentations to educate students on different healthcare paths. And they lean on partnerships to increase access to programming, and they're utilizing those in the field who can showcase their day-to-day and what they do in their given profession. And each of these slides we're going to show as well has a graphic from our annual report that showcases the number of participants that are impacted by each goal, specifically last year. So for example, we saw nearly 3,000 students last year participate in some pathway program across the state. And you can see those percentages here too. Many were from a disadvantaged background, considered underrepresented in medicine and or from a rural community. And we also survey our participants to find out what the impact was of that programming and if it influenced their decision to pursue a healthcare career. And so we track that very closely, and that helps us with quality improvement and working towards meeting those goals that I mentioned. The next goal is all around clinical training and community-based experiences. Those clinical experiences give our students the opportunity to rotate in community-based clinics and really across interprofessional teams. That's an important part of this as well. And of course, they're working in these rural and underserved areas. So they're learning about those populations and the unique challenges that come with that. Our medical and allied health students are placed in rotations all over the state, again, with that focus on primary care and rural and underserved areas. And then the community-based experiences can include a variety of things, interprofessional education activities, lunch and learn, simulation days. Again, that's just a partial list. There's many different types of opportunities that are encompassed in that as well. And then the survey data for those who participated in all experiences and just in those clinical trainings are listed there as well. And Dr. Taylor is going to talk a little bit about the impact of the experiences on the students completing them, many with you all as critical access hospital partners around the state. AHEC Scholars is one of our most significant programs. It's first started back in 2018 when HRSA introduced this concept to AHECs, and so we're still a fairly young program within that with Scholars, but it is a 2-year program that really is aimed to improve students' practice readiness. Students are eligible once they're in their final 2 years of a health professions program, and that combination of online training and community-based learning, it breaks down around 40 hours of didactic training through a learning management system, and then 40 hours of community-based learning in the field. And they do receive a stipend, those who participate in the program, that helps them with travel expenses, housing, whatever it might be, other related expenses in order to complete the program. And you can see from the numbers below, we did increase our Scholars graduates significantly from 2022 to 2023. And as we've done like the previous 2 slides, we have some survey data you can see here. We're always in recruitment and retention mode with Scholars. So, we welcome the opportunity to talk to students that you may all know who are interested, and to any professionals too across the state who are willing to work with our Scholars in a variety of ways. And then finally, the 4th goal, or that 4th bucket, is professional development and continuing education. This is really aimed to those practicing in rural and underserved areas. And again, this is a partial list of some of the different offerings that we support, we carry out, implement a variety of different things: staff development, interprofessional education, simulation events, in-person training, webinars, and there's a variety of others as well. We can support these efforts through funding, through equipment, through actually providing some of the content as well. So a variety of ways for us to get involved with professional development and CE. And again, another breakdown of last year's impact. We have over 500 professionals who participated in some continuing education, professional development programming, with some of those metrics as well, and how that impacted their communities and in their minds. And then, of course, we're always looking at those outcomes. And so every few years, we do what's called a match, where we look at, with help from the Professional Licensing Agency and some other entities with IU, we find who's licensed in the state in a variety of disciplines, and then cross-reference that with our alumni who have gone through some kind of AHEC programming as a participant. We found we have nearly 10,000 alumni practicing in Indiana. And that number just keeps growing, obviously, as well. And last time we looked at the data in 2021, we had 41% who were working in HPSAs, or health profession shortage areas. We're currently looking to see if that percentage changed with our updated count. But again, a significant impact that we aim to have on our state, and we can see the number of alumni and the number who are participating in those areas continue to grow. So I'm going to go ahead and turn it over to Dr. Taylor for our next couple slides.
Yeah, thank you. So Greg did an incredible job with sharing with you kind of the broad overview of the amazing thing that AHECs are doing across the state. And I wanted to drill down a little bit and highlight our work directly with critical access hospitals, starting with the highlight of all of the different partners that we have within the hospital systems across the state. So major kudos to everyone listed here. And please note there's always space to continue to grow our list. Next slide, please. Our work with critical access hospitals currently involves 2 types of programs. The first is providing clinical training opportunities for those health profession students. As Greg shared, we're really focused on connecting students with hands-on experiences in those underserved communities across the state. We really want to ensure that we're removing any stigma or doubt and increasing their knowledge and self-efficacy to really care for vulnerable populations. So we're able to show that students are reporting an increase in knowledge on how to collaborate with other health professionals in more team-based care, as well as how social determinants of health and cultural background really impact patient care. So as you can see here at the graph, we have a very clear improvement in student knowledge based on their experiences at the critical access hospitals. Next slide, please. Thank you. We also look specifically at for students for self-efficacy or their belief that they have the skills necessary to care for vulnerable populations. We are thrilled to see that based on the students' experiences at your facilities, that they feel like they are more skilled to work with individuals from diverse backgrounds in order to meet the needs of those in underserved communities across the board. Next slide, thank you. And finally, we all know, we feel it, that we're facing this ongoing workforce shortage. It is not a new thing. I mean, AHEC's mission is all about improving the diversity and the distribution of our healthcare workforce. We need to get more students out there and wanting to practice in underserved areas when they graduate or complete residency. So it's natural that we want to know where the students are intending to practice. Greg mentioned when we were looking at our alumni that in 2021, we found that 41% are licensed and practicing here in Indiana in health profession shortage areas. And that almost 10,000 number that we have from this month, actually, we're looking at around 41 to 51% as well. We're just confirming the validity. So it really shows the impact. So even when students are still in their experiences, we are so excited because we see an increased intent not only to stay in Indiana, but to practice in underserved areas based on their clinical experiences they're having with you. And then shifting gears, a lot of our AHECs partner with you on continuing education opportunities so that we wanted to highlight the positive impact that the professional development events are having around your team, and they're feeling that they have the resources and the tools, the knowledge and the skills to improve patient care. So with that, I will turn it back to Greg.
Thanks, Dr. Taylor. So some of you are precepting our students and have worked with them for many years. And so what we want to do here is just share some insight from our current preceptors who were asked questions about their experience teaching and precepting students. And we took out a few quotes from them to show the impact it has on them as professionals, but also the impact that they have on students and that relationship. So I'll let the group read these, but as you go through those, you can see the themes of giving back, paying it forward. Many have said it provides experiences that they've had with future health professionals through teaching and the value that has. As you know, on the call, there are unique challenges with rural medicine specifically, and that's a theme in these testimonials as well. And then our preceptors too were asked about benefits of teaching students that they didn't expect to experience and advice that they would have for colleagues considering becoming preceptors. They are also asked to provide advice to those considering becoming preceptors as well. You can see some similar themes emerge in these answers. Feelings of feeling more fulfilled, being able to share skills and expertise with the next generation of health professionals, benefits to patients too. Based on the students who are in that learning mode, having the ability to spend extra time with patients and being able to influence and impact that care plan and work with the health professionals and the healthcare team to be able to have that influence on it. Again, I'll let you read these for a second here as well. And if you have some interest, if you want to get involved, as I said, here is our contact information. You can reach out to either Dr. Taylor or I, and we're happy to provide more information as well about what we're doing across the state. We do have our website there as well, and I know the slides are being shared with everyone, so feel free to follow up with us. And at this point, we'll welcome any questions from the group and just appreciate the opportunity to share about AHEC today with all of you.
I don't see any questions right now. Maybe Jennifer and Greg, maybe you can touch on what type of examples that hospitals have used with the 21st Scholars when they bring them on site. Can you maybe share some projects that they've felt that they really address that gap?
Good, Dr. Taylor.
I was going to say, I actually am not familiar of how they have used 21st Century Scholars, because a lot of times with the high school students going pre-COVID, going into the hospital, there's a lot of shadowing and volunteering opportunities for those students. But unfortunately, due to the pandemic, a lot of the opportunities went away. And so I've not been familiar with, outside of collaborating with hospitals for specific career exploration camps during the summers, I'm not sure how they are able to continue to collaborate for those students. Now, it's different, obviously, when we have health profession training students that may have been 21st Century Scholars as high school and undergrad. That's a little bit different because that's part of their academic training program now.
And I would just add that that's part of the ongoing collaboration and discussions we always have with partners and with whether it be health systems, schools. So if ideas come up, our 9 regional centers are always in those discussions to talk about how can we make this work, how can we make something possible, and at the state level as well in the program office, we're having those conversations. So if anybody on the call has ideas like that, or I know Joyce, we've had some conversations already about how to partner, and so we obviously want to have some dialogue and see what opportunities might be out there.
I know just myself, just being in the hospitals and obviously with workforce still being for most part at a critical point. I just saw an opportunity when we're talking about more of that patient navigation, more that community health worker, being able to reach out and perhaps do like those follow-ups for those patients that we see that come through the ER frequently, maybe being able to give them calls, you know what I mean, to kind of see how they're doing, being able to kind of fill those gaps where you wish you had extra hands, but you don't. So those want to do things kind of always get pushed back down to the bottom. But I just saw like these students, whether it be at that high school level or more in your 21st Scholar programs, you know what I mean, being able to come in and really fill those gaps and be able to do those, want to do things versus what your clinical staff is really focusing on, what we have to do.
Yeah, there's a lot of great opportunities. And I know recently our metropolitan Indianapolis, Central Indiana AHEC, which is part of the University of Indianapolis, so they cover Marion County and the Donut counties, recently have become accredited by ICHWA to become a certified health worker training. I know several of our other AHECs are looking at opportunities or partnering with other groups that already have that accreditation. So there's a lot of momentum to try to improve the community health worker workforce in general. So that's a great opportunity to think about how do we combine multiple programs together and really make a difference.
And we just started a brand new 5-year grant cycle with AHEC, with HRSA, and that was one of the new emphasis, or one of the main emphases was on community health workers and developing programs, training programs, pathways, opportunities. So yeah, those are active discussions we're having on, this is the first year of that new cycle and figuring out how to best do that. So yeah, new ideas like that would be welcome and ready to have those conversations.
Yeah, I've started to engage in that conversation as I'm out visiting hospitals. So I was so excited to see that list of hospitals that are currently engaged. So I would say to the hospitals that if you would like to learn more, please also feel free just to reach out to me. I've been reaching out to your local AHEC office to see, and be able to kind of sit down and brainstorm with them to see what are the gaps, what is the capacity that they have, and that what your needs are, and really bring that together. I just see this program as such a great way to start fueling our future healthcare workforce, and especially utilizing the people that you have currently residing in your community to stay in your community and be able to come and work in your facility as they prepare for their healthcare career. See, I'm looking to see, I don't see any
I have-
additional, go ahead, Becky.
Was gonna say, I have a question. Who is your primary contact at the critical access hospitals? Is your contact primarily in human resources? Is it the chief nursing officer? Or does it vary from place to place?
It absolutely varies from place to place. So as Greg shared, single one of our regional centers not only has an advisory board that might consist of members of critical access hospitals and other educational and nonprofit organizations. So really, they are the boots on the ground that work directly with their critical access hospitals. So we don't have a repository here in the program office of who would we contact. Now, what I do have is a database, so I have an idea of where the programs have been happening and what kind of programs are happening, but I don't have the contact directly.
And is there a larger group of students that are looking to be a part of the AHEC programs so that critical access hospitals have a better idea of ways they could utilize services?
Yeah, so that's a great question. So there's a couple of options depending on the needs of the community, right? So in thinking about if it's clinical training, then the AHEC is helping to connect with the local universities and those nursing students and social work students, et cetera, medical students that need clinical training hours and trying to provide that connection for the students. If it's our AHEC scholars, as Greg shared, that we have a very willing group of typically about 250 students a year that always need community experience hours, where we're really trying to get them into the community to better underserved volunteer basically have volunteer hours to understand underserved communities. So we definitely have a captive audience. The question is more of what is the interest of the hospital and the capability and which way they would like to utilize students so that we can find the best fit for them.
Thank you, that's helpful. And so I'm thinking about dental in rural communities. So what kind of projects have you done around dental and oral care?
That is definitely an area of need within the AHEC. Several years ago, we collaborated with the IU School of Dental to do a rural-based externship, essentially. But the challenge is because they have so many students, they really needed to have clinics that were at least 7 chairs, and that is very difficult to find, for example, in a rural area. So we do have members of the dental school on our statewide advisory board, so we're always open up to collaboration, but that's definitely an area of need. Primary care has traditionally been the focus of AHEC, and it needs to not be the only focus. And so we've started looking more at the behavioral health and substance abuse workforce and how do we better build skills of that nature. But you're right, we can't include the dental workforce as well.
Okay. Question that just came into me, does this include dietitians?
Yes.
Okay. Thank you. I know that we're starting to hear more about, shortages in that particular area. And once there's an opening, there isn't applications coming in for those positions. So
yeah, it's really exciting that we have a lot of flexibility. We get to think about the workforce from all levels, from entry level thinking medical assistants and certified nursing assistants and community health workers, all the way up to physicians and nurse practitioners and that. So we really have a wide variety in which we can think about what is the health workforce that is most needed within the community, and then how do we help kind of make those connections to ease the burden and remove the barriers of access, especially because we know that those that are from where you're from and where you train are the highest predictors of where you're going to practice. We also know that our communities want to go see health professionals that share their background, that look like them, that understand their needs, right? And so we really want to think about how do you kind of pull all of that together and create a workforce that's really diverse across all levels and is really willing to serve in our most underserved areas across the state. It would be a great problem to have if we ended up keeping all of our workforce so we didn't have the HIPSAs anymore. I would probably work myself out of a job, but it's the risk I'm willing to take.
Okay. Thank you. Another question that came in is, we are partnering with our local schools, thinking about future workforce. What are some types of projects that you have had high school students work on specifically?
Oh, that's a great question and one I can't answer. Greg, do you have any ideas?
Yeah, I mean, it depends again on the region where everybody's doing a little bit different things, but I think we've talked about those summer camps, and high schoolers are a target audience for those. Centers are in the schools working with teachers, working with career counselors or with school counselors just to figure out what programming might look like to expose them to health careers. And so they do a lot of hands-on work. We have a newsletter we put out quarterly, and I'm getting some information from our centers, and they're getting donations to look at lungs and body parts and get the kids out in really doing that type of work hands-on so they can really understand what the different careers are within. And so there's sky's the limit. I think we have centers who interact with different schools and with staff and students and figure out what's going to be impactful and what are students wanting to see to help them get exposed to different health career paths.
I think one of my favorite stories is one of our center directors. They just left the East Central, but they had a background in education and athletic training. So they partnered with the butcher's office to get a bunch of old bones, like animal bones, and they partnered with the hospital to get a bunch of expired supplies, gloves and masks and all that. And they took them to the local school and allowed the kids to use the expired PPE to dissect the bones. And it was just a really hands-on, really fabulous way to get them excited. We've got other partners such as the Indiana Respiratory Care Association that will come into events with their lungs diagrams, and students get to see them and see what happens based on tobacco smoke and just a lot of those different things. Because what we found with a lot of high school students is what they know is what they see on TV, right? And so if they see, I can't say ER anymore, it's like what Grey's Anatomy is still on, so I think I'm safe there. So they think they all want to be a pediatric oncologist, when really what we need are certified nursing assistants and nurses and social works and dietitians. And how do we expose students to those types of careers so that they have a gamut of what to choose from?
And I'll just add quickly, a lot of the programming too comes from existing relationships that we have as AHEC with HOSA, for example, with JAG, those types of programs that exist around the state, and those schools that have chapters and active chapters of those programs in their schools. A lot of those, that collaboration results in some really unique programming and outside the box ways to, again, provide some hands-on experience and exposure to different health careers.
Great, thank you. That was helpful. Another question that came in is, do you work with non-traditional students? If so, how or who do you target? These older individuals who may not be in middle or high school anymore, but may be interested in health careers. It's a good question.
Absolutely. We definitely work with adult learners. That could include anyone that even has, for example, an incarceration background, or they're just a second career background. They can contact the local AHEC and just get more information about opportunities that are there. It varies by region, but it's definitely, we do not only target those that are in youth programming. We really have that continuum across the workforce. So.
And I can think of one example, our Mickey AHEC, which is the Metro Indy area and those donut counties. They do have a program, summer program for those non-traditional students, a program, so they can get, they missed that opportunity, things have come up, and now they can come back and just really learn about pathways to a health career. And so that's one example of those, our local AHECs, regional AHECs targeting that population.
Thank you. Joyce, I believe that's all the questions I have on my end. Kathy, do you have any?
No, I do not.
Joyce, anything else from you?
No, but thank you. Thank you, Greg. Thank you, Jennifer. I appreciate so much your time today. I'm so excited to see what the next months hold as far as us continuing to work together and get you exposed out there and all the services that you all can provide. So thank you so much.
Well, I appreciate you helping us not be a secret anymore. That's been a challenge. In the decade that I've been with AHEC, we've been a secret forevermore, and I just don't understand it. So I'm so excited to continue to collaborate with more people.
Thank
you for
you.
the opportunity, Joyce, and all.
Thank you. And Becky, I'll turn it back to you at this time.